Hey everybody, it's Ashley, physical therapist for TravelTrim. I am here with my friend, Dr. Becca Ranz, sorry about that. Dr. Ranz is a osteopathic doctor, a DO, and she practices functional medicine. Tell us a little bit about yourself, how you found yourself in functional medicine, and then let's transition right into what is functional medicine.
Okay. So I started out with the plan to become a physical medicine and rehab physician. So after I finished residency, I chose to work in the skilled nursing facilities doing consults with mostly elderly patients who had either just become deconditioned from being ill or had joint replacements, those kinds of things, surgeries, and helping with their rehab progress. During that time, while I really enjoyed working with that patient population, I started exploring kind of the idea that there has to be something different, like a different way to look at things. Just feeling like I was really missing so many opportunities to help people avoid those situations.
Prevention.
Yes, exactly. And I found my way sort of finding podcasts and other things that kind of gravitated towards the functional medicine space. And so I started learning about it while still practicing PM&R. And, then 2020 came along and I had...
Paradigm shift during pandemics, apparently.
I had a little forced time away because... where I was working at the time, they weren't allowing anyone in except for, nursing staff, and then their primary care provider could go in, but they weren't, I was considered a consultant, so I was not, they weren't having any extra bodies in the building, essentially. Right. So during that time, I started thinking, maybe this is when I need to, start making some changes. I've always wanted to do this and never taken the time, and so that's
as in functional medicine.
Yep, this as in functional medicine.
So what is functional medicine?
Yes, so functional medicine, the main definition would be root cause medicine. So it's the idea that any illness or symptoms that you're experiencing have a root cause, so to speak. So something that's causing it. So if you have something like high blood pressure, like different parallels would be if you have high blood pressure, you might go see a traditional physician who would say, well, you have high blood pressure, here's your medication
to lower
the blood pressure. And we might say, while there's still a role for making sure you have a safe blood pressure, right, maybe there's something else that we need to look into, like why you're having this high blood pressure. Now, often we have some parallels because I think that traditional medicine likes to look at things like weight and things like that, which can play a role, but we delve a little bit deeper into the causes of why people are sick.
And so there are a good number of physicians that want to look for a cause, but still, when they're conventional medicine practitioners, they treat symptoms. Like, you have high cholesterol, here's a med to lower it. You have high blood pressure, here's a med to lower it. Whereas functional medicine has the ability to not only prescribe medications to keep numbers safe, but also look at what's going on internally or externally that's contributing to the high blood pressure.
You got it.
Okay.
Exactly. So we just try to help people change. It often comes down to lifestyle changes and the role that plays in their disease process.
So with lifestyle changes, diet, and I don't mean diet as in go on a diet, but right, what you're eating, your nutrition.
Yes.
And then exercise or activity level.
Yep, activity level. Sleep is a very big one.
Oh, I don't know what that is.
Sleep is huge. But yeah, we try to make it as individualized as possible. We're learning so many new things every day, and like anything else, keeping up with all the new technology and everything is always challenging. But we try to look at each person specifically and how we can help them change things to improve what's going on.
So let's take a few topics that I know a lot of people are interested in.
Mm-hmm.
Let's talk about hormone balance, because I know that functional medicine doctors, they want to know what your hormones are.
Yes.
Why? Why is that important?
Our hormones are important for running so many processes throughout the body. And, it's really just one piece of the puzzle, but it's one that we can test for. I can't test I can't take a blood test and tell how much you're sleeping, if you're getting restorative sleep or recovering well overnight. I can't test that way. Now you could get a sleep study, but as far as like coming into the office and doing it right then and there, I can't do that. Same with what you're eating. I can't take a blood test and say, oh, you had, adequate protein last night and this and that. It's just one of the things. So I like to think of your health as like a pyramid or a stool, either way. But basically the foundation is built up of sleep, your diet, as in like what you're eating, your nutrition, your hormones, and your activity level.
Okay.
Like those four things are going to be the foundation of anything and everything. And so the hormone piece is one that we like to look at because it's going to dictate energy levels. It's going to dictate your ability to build and maintain muscle. It's going to look at your ability, in some cases, even to have difficulty losing weight. Mm-hmm. Your metabolism. So all of those things,
And there are things that you can do as a functional medicine doctor that address any problems that you see with hormone balance.
Correct. Okay. Yes. Yep. So we definitely go that route with either the bioidentical hormone replacement route or even just certain supplements that can kind of help your body boost things naturally. That kind of thing.
I've heard a lot about estrogen and males having too much estrogen and females having too much estrogen dominance.
Mm-hmm.
You look at that and then you can make lifestyle changes that could adjust that.
Correct.
Cool.
Yes.
Now, you mentioned metabolism. That was going to be my next topic. Metabolism and digestion. Obviously, we care about what we look like. We care about how we feel. But and metabolism and digestion are parts of that. But what else? Why is it important to have a good, healthy digestive system?
Oh, yeah. I mean, first of all, your digestive system starts at the mouth and, of course, ends at the end. So all that tissue in between is going to house actually the majority of your immune system. So having a healthy gut, so to speak, digestive system, that's going to be paramount to healthy immune system, immune function. It can even be a source of inflammation throughout the body if we are not treating our digestive tract well with the foods that we're consuming. And
so elaborate a little.
Yes.
Let's just take average Joe or Jane off the street. What are things that are bad for the digestive system for anybody? Like,
yes.
What do we need as humans to avoid?
Yes. I think that the biggest thing, which I'm sure many people have heard now because it's a very popular topic, but certainly the processed foods are the thing that, it's just not providing good nutrition as far as the value of the food that you're eating. It's typically very processed, has high calories, and very low nutritional value for that amount of calories. Those are really the main things. I mean, to me, life is about balance. So I'm not saying you can never, ever, ever, ever touch a processed food. I think that would be fairly unreasonable. But, and I also am okay with whatever diet you choose to subscribe to. If you want to be vegetarian, or you want to be vegan, or you want to be paleo, those things I think are individual choices and what works well for someone. Sometimes one diet you might think is working well for you, but trying something different can really open your eyes to a new world. But anyone, no matter which of those diets you choose, should be avoiding processed foods, as a regular thing.
And when you say processed foods, it doesn't necessarily mean that it comes in a box. What are some forms of processed foods that people are consuming that they don't realize are processed foods?
Ones that you wouldn't realize. I mean, honestly, anything that's already been prepared is what I would consider processed. Unfortunately, when you go to the freezer aisle, when you're going out to eat, like, all of those things are going to have, I won't say all of them. I'm sure there are restaurants that provide more whole food type meals, but often they're going to have very high salt contents and hidden ingredients in there that you wouldn't necessarily expect.
Preservatives to keep it fresh during transportation and storage.
Exactly.
Okay. Deli meats, like the pre-packaged meat. I wasn't aware that that was considered a processed food until I started doing some study into functional medicine. I thought I was doing healthy things, grabbing my cheese snack, or cheese stick and turkey, but I realized that it's chock full of stuff. So instead of grabbing the pre-packaged stuff, we can go to the deli counter and get them to cut meat for us.
And that's better. It's still going to have more preservatives than if you go and buy, just a fresh turkey breast and, cut it yourself at home. Like, bake it and cut, that's going to be as close to the whole food source as you can probably get. But definitely the ones that are made to last for a long time on the shelf. When you look at the sell-by date and it's like 3 weeks away, there's probably a lot of preservatives in there to keep that fresh.
And those chemicals mess with our digestive tract.
They can, yes.
Okay.
And just our overall cells anywhere in our body. And again, another thing I like to think about with health is it's kind of like a scale. So can you eat that stuff and not really move the scale too much in small amounts? Probably, yeah. But it's all going to depend on your overall lifestyle and how many things you're exposing yourself to. Like, how many other chemicals are you being exposed to? What's your job like? What are your exposures there? What kind of water are you drinking in terms of filtration? It's an overall load. Yes, lotion, shampoos, makeup,
hair dye.
Yes, all of it. So it's kind of an overall exposure type thing. So if you have that turkey once a month and you're doing all these other wonderful things for yourself, like, your body may do okay with that. That's kind of where we come in to help piece out.
Okay, so that's where you can help.
Yeah, how much of a burden are you placing on yourself from all these sources?
And back to digestion, I know constipation is a big issue. I feel like one of the main reasons people are constipated is because they're dehydrated, just overall, not enough water.
Yes.
But what other outside of feeling terrible, what other detrimental effects will constipation have on your overall health?
Yes, so long-term, people that suffer with constipation long-term, it can lead to a condition called, like, diverticulosis, which is basically little pockets that form in the colon, and they're little out pockets, and then stool can get stuck in those little pockets, and then that can lead to something called diverticulitis, which is basically meaning inflammation. And so that would be one thing. Just overall, staying constipated is not going to allow for good absorption of your nutrients. It's not going to allow that gut to do what it's meant to do. It's meant to move things through, and if it's all sitting there and becoming stagnant, it's just not gonna go well.
So our gut is supposed to allow for absorption of the nutrients that we need and get rid of things that we don't need. But if we're bogging the system down with processed chemicals and toxins, regardless of where they're coming from, then it's not going to work that way.
Correct.
And you said that it would have an effect on inflammation, which, I mean, that could have an effect on our eyesight, our joint health, our muscle aches and pains, as well as our immune system, correct?
Correct. Absolutely. I mean, it is amazing how many different complaints you might get, like how one person's inflammation might present itself, so to speak, versus another person. So some people it's purely, joint pain. Some people it's like no energy. Some people it's, not being able to lose weight. Just all of those things. It could be anything. Others, skin problems. I see a lot of
acne.
Yeah, acne, just rashes. And then, we see the immune function problem, and then worst case scenario, you end up with something like an autoimmune disease, which I think often starts in the gut.
That's crazy. And when you say autoimmune, it's like rheumatoid arthritis. What are some other common?
Like Hashimoto's thyroiditis, rheumatoid, lupus, psoriasis, any of those would be considered an autoimmune disease. So
do you think, in your opinion, if someone has a genetic propensity for a rheumatic condition, can they take preventative steps by having a healthy gut to avoid that?
I do believe
diminish
that.
the possibility.
I think that, our DNA, our genes, everything sort of loads the gun, so to speak.
Okay.
But our lifestyle, our environment, all those things would pull the trigger. So now I'm not saying that this is going to fix everybody's problems ever. I've certainly had some cases where people are doing everything that they can and they still, suffer from their autoimmune disorder. It doesn't fix everyone. There are more than one reason to have a disease, but there are just as many stories where finding the proper things to avoid in your diet that are inflaming your body, and there's just as many of those stories of people either healing their autoimmune disease or at least getting it down to a point that it is not noticeable for them.
And cancer the same way. People have often changed their course of their cancer by changing what they're putting into their gut and the toxins and chemicals in their bodies and such.
Yes. Yeah. It's amazing.
My mother was one of those people. Now, her functional medicine doctor told her to avoid sugar like it was the plague.
Yes. And, that's a common one for
And that doesn't
cancer.
just mean candy.
Right. Yes.
Unfortunately. Sugar is everywhere.
It is. It is. It's hidden everywhere.
Especially anything that says fat-free. We've learned that was a fad that needed to go away with the 80s clothes.
Correct. There's a lot of fads, and we'll see, which one of these things that we're doing now ends up being something that we change our mind on, but,
But the fat-free in particular,
yes,
it took out some actually nutritious stuff and chocked it full of sugar.
Yeah.
To make it fat-free. Okay. So you guys be careful of things that say fat-free. It doesn't mean that it's healthy.
Correct.
Okay.
Absolutely.
And with any questions about your food, honestly, going to see a functional medicine doctor is probably a phenomenal place to start.
Yeah, absolutely.
Because it will help your hormone balance, which will affect energy, sleep, not to mention the reproductive issues that people are having now.
Yes.
That I don't remember when I was a kid ever hearing of someone having a hard time getting pregnant or miscarriages. And now I feel like every other person I talk to.
It's true. I mean, you know, I think that, again, that kind of comes down to our overall toxic load, so to speak, that we have nowadays. I mean, I honestly believe that we are putting so many things on our bodies, cleaning products,
Cleaning
everywhere.
products in the house.
Anywhere, really.
Yeah.
Have hormone disruptors. The chemicals that are in them can be disruptive to your hormone levels. And I will say that I'm seeing younger and younger people with, you know, very low testosterone levels. It's just not right. I don't know.
And yeah, it's got to be something with what we're eating and the environment around us.
Mm-hmm. And there's plenty of research out there. Anyone listening that wants to look into things like phthalates, especially, I think those are the biggest players right now in disrupting our hormones. And it's unfortunately in just about everything.
Like, what do we look for when we read a label?
So
that if we see it,
yeah,
don't get it.
Yeah, anything that says fragrance is going to have phthalates in it. And all it has to do is say fragrance on the bottle. And the phthalates are the chemical that allow that fragrance to linger longer. So like laundry detergents, cleaning products, candles, scented candles. Anytime you're smelling the fragrance, perfumes, colognes, all those things, shampoos, all, that's because of a phthalate. And so when you think about the world that we're living in now, that kind of stuff is everywhere. Everybody wants to smell good, which I get.
Yeah. What about those things that are, say essential oils?
Now, essential oils are typically okay.
Okay.
As long as, I always say, if the ingredients if the list of ingredients is very transparent and it's telling you, but when it lists, you'll notice a lot of times it just has in parentheses at the end fragrance. Mm-hmm. That's like a proprietary blend. They don't have to tell you what's in that. So often you can find things like shampoos that'll say phthalate free or sulfate free or this free, but then it still has fragrance in there. Once it's a proprietary blend that they don't have to list the ingredients in, then it's still in that ingredient. So everything else that they put in there is phthalate free, but
their proprietary blend
doesn't have to be, because they don't have to disclose what's in that because it's proprietary.
So we need to have like a whole course
yes.
on how to read labels.
Yeah. It's challenging.
Yeah. Oh my goodness.
So that's the easiest one to start with, is choosing as many products as you can handle that are fragrance free. I think that's like the first step. So whatever you can manage to get rid of fragrance wise is going to decrease some of what you're exposing yourself to.
And I would love to end this. Actually, we need a part 2. I want to deep dive into some of this. But before we leave,
I didn't get to all my things.
Before we leave today, I would love, because we're, a corporate wellness company, yes. I would love to talk about, in your opinion, how important is consistent exercise?
Oh yeah, that is about as high up on the list as you can get of importance.
What does it do for you outside of make you, fit and trim?
Yeah, it does everything for you. Just moving your body. So, number one, we have a huge problem with type 2 diabetes in this country. Huge. And I believe if we could just get people out walking every day, we could reduce that number hugely. Our skeletal muscles are huge consumers of glucose in the body, and just using them. We sit too much, we just aren't moving. So that's going to be huge. If you have any trouble with insulin resistance or type 2 diabetes, like moving is so important. It's going to help with your digestive system. In addition to drinking enough water, if you are not moving your body, your bowels are not going to move well. They're just not. Our bowels respond to movement. So you got to get up and move. Let's see, what else? Brain health. Brain health is a huge one. Exercise is going to help with your brain staying healthy, not getting, helping prevent things like dementia and such as you get older. Again, I think it's probably goes somewhat hand in hand with that glucose problem and insulin resistance, but just using those muscles. And we also talked about hormone imbalances. Your muscle is going to be a huge producer of testosterone. So if you are using your muscles, you are going to boost your body's natural production of testosterone. Great for guys, equally as great for women, because even women need testosterone. We need it for
so much more than sex drive.
Yes, so much more than sex drive. I mean, just our energy levels, our ability to get up and go, and then of course maintaining muscle mass is so important as we age, because that's going to prevent things like falls and all the things that I saw in, when I worked in the skilled nursing facilities doing rehab. So we've got to maintain that muscle mass.
And then there's so much research about the correlation between psychological and emotional well-being with adequate exercise.
Yes, that's a huge piece too. I mean, there's just really no way to avoid it. You need it.
You got to have it.
You got to have it.
And it's not just a 3-day-a-week thing. It's daily movement.
Daily movement.
You hear that? Daily movement.
Yeah. You can have, your movements that are less intense.
Right.
You can have your days of lower intensity, but you got to move. And if you have joint pain, I always tell my patients all the time, I know it hurts, but sitting is going to make that pain worse. Mm-hmm. So you got to move. If you keep moving, a body in motion stays in motion. That's what I always say. So you just got to keep moving.
My spine doctor, my orthopedist, says motion is lotion. And sometimes you gotta move it enough to where it starts lubricating itself, but you gotta move. Mm-hmm. All right. Well, there's so many other topics that I would like to cover with you. I want to do a part 2. We're going to do a part 2 with Dr. Ranz for sure.
I've got a lot more. I didn't get on vitamin. I was going to bring up vitamin D, all these things. So we can talk about
We'll talk about that, because there's some great research right now with vitamin D, especially it seems to be a topic with COVID and all of these things. So we're going to do another discussion. But for now, I want to try to summarize.
Okay.
Functional medicine is important because it's going to look at the root cause of why you're having the symptoms that you're having. Want to prevent further issues, maybe reverse some of the things that we have done detrimentally to ourselves, and having somebody to guide you through that is incredibly beneficial. And while it might not be as easy to find as a primary care provider, so to speak, functional medicine is becoming so much more popular. You can research functional medicine and find a practitioner near you, and insurance is also beginning to realize how helpful functional medicine is. So you can find functional medicine doctors that do take insurance as well.
Correct.
So it's good to have somebody on my team like you. Dr. Ranz helps take care of me as well. I have lots of doctors. But we'll continue this conversation soon, because I want to deep dive.
Anytime.
Awesome.
Love to. Okay.
Thank you.
Bye, everybody.